Welcome back to Healthy Living. I'm your host, Melissa Hodgson. The show is brought to you by St. Tammany Health System. We're talking today about community health resources. We learned about A Healthier North Shore, which is a community-wide initiative from St. Tammany into Washington parishes, from Joan Kaufman, CEO of St. Tammany Health System. And then we learned about the Be Well Bus, which is a mobile health unit from St. Tammany Health System, from Ann Pavlovich. And next we're going to hear from Erin Strain, who's with us to talk about corporate health solutions. Erin, welcome to the show.
Thank you for having me.
I'm excited to have you here. You've never been on our show.
I have not.
And Corporate Health Solutions is a part of St. Tammany Health System, and it has a focus on employers. So tell me, I guess big picture first, what is Corporate Health Solutions?
So St. Tammany Health System did a really good job. We've had this program for about 15 years. So 15 years ago, they recognized the need to make sure that we were being more of a resource to our community. And what better way to do that than to reach people where they are at their place of employment. And so we were able to help employers to navigate our health system. I mean, if you're not in the healthcare industry, it can be very daunting. And so we were able to help them with their occupational health needs, their workers' compensation needs should that arise, and then their general health needs. So let us help you keep your work staff healthy.
Wow. Okay, so I get the big picture, and I like that it's 15 years old. I had no idea that the program had been around that long. Who's eligible? How do people or companies become eligible for corporate health solutions?
Any local company in this area is eligible. There's really no requirements, and some companies choose to use different pieces of the program. So not every employer will use every piece. Some just want general help with their general health needs. They want us to come in and talk to their employees about what resources we have at the hospital.
Okay, so it might be, like you said, it could be occupational health, it could be workers' comp, but from a general health perspective, you can actually go on site and do lunch and learns about quitting smoking, or have someone come talk about healthy eating, or knowing things about signs and symptoms of stroke.
Yes.
Any of those kind of things.
Yes, so we actually, we are the connector for the hospital resources. So the person in this position would make sure that if the employer had a specific need, that we were able to connect them with the correct hospital resource. And then yes, we do like to meet them where they are, go on site, do a lunch and learn, do a presentation, do a free blood pressure check, help them establish with a primary care physician to utilize their well visit. A lot of people don't understand that your well visit is annually and it's covered at 100%. And we're doing this all complimentary. The hospital has said, this is a community need, this is a way we can be of a resource to you, and we don't charge them for it.
Wow. Okay, so a local employer could have you come talk with employees about healthy choices, but you could also bring the Be Well bus to do some screenings or vaccinations or things like that. And you can individually work with those employees in that business to get them lined up for care that their health insurance that their employer provides would cover.
Correct. So
amazing.
More recently, we've actually had Dr. Michael Hill do some vaccination webinars for a lot of the employers in the area, and then we'll schedule the bus to come out afterwards. So we're giving them the information and the education they need on the vaccine. He's so good too. He's not at all the hard sell and the pushy. He really just wants people to understand. But because of that, we've had people actually get vaccinated. And like I said, we'll meet them where they are. We'll bring the bus out to them. It's all very seamless.
Wow. Well, I like that, how nimble that is. You're talking about a 15-year-old program that has been, in its history, very focused on occupational health, workers' comp, those kinds of things, how to keep your workforce healthy. And now, elbow deep in the midst of a pandemic, we have this terrible situation where misinformation has caused people to be afraid to get the most effective solution to COVID, which would be a vaccine. And so Corporate Health Solutions can bring an expert, a local respected expert, to speak directly with a group of employees, and you have the added benefit of the Be Well bus being there ready to go ahead and put that vaccine in the arms of everyone as they feel comfortable to do so.
Yep.
Oh my gosh, I love this. That's the logistics of it are just beautiful. It's very seamless, and I think making it easier for local St. Tammany employers to add a benefit to their staff and to help their staff use the benefits they have, which generally we all have health insurance, but sometimes we don't do a good job of using what the health insurance has to offer.
Right.
Okay. Well, you mentioned that there's no cost to it, which I love, and that's a commitment on St. Tammany's part. But our partner, Ochsner Health, also has a component and can help out with corporate health solutions. Can you talk a little bit about how the partnership brings the benefit?
Yeah, so through our partnership, we're able to further augment what we were previously offering our employers. So we are now talking to our employers about a digital health solution. So do you have a high population base in your company of employees who have, uncontrolled diabetes or hypertension? Can we bring that solution to you? Can we talk to you about what that would look like for your staff? Can we talk to you about the virtual health clinics? So sometimes you'll have employees that are sick or unable to get to the doctor, and it may not be that they're contagious or they're, I don't want to say too sick, but this is an option to have this clinic. It's amazing. It's actually an iPad and a bunch of different peripheral devices that can take your temperature, listen to your heart sounds, do a blood pressure check, and you're actually able to have a virtual visit with a physician without leaving your place of employment.
Oh my gosh.
So yeah, if you're having a headache or you're just, whatever it might be.
That's really amazing. I'm thinking about, in some situations like at the hospital, we have an employee health department and we have an employee clinic. So if people need something, they can be seen. But, that's because we're a hospital.
Right.
If you're a printing company or you're a retail establishment or, you're any number of other types of doctors offices, lawyers, et cetera, to be able to have this piece of technology resident in the office, then people can get themselves checked out by a health professional through corporate health solutions.
And the whole goal here is to help employers control their cost. So every year, healthcare premium costs are rising. So if we can help you control the health of your population health movement, and keep them healthier, your costs are not going to rise the 20% or the 35% that you might see if you have a more sick population. So the digital solutions through hypertension and diabetes, the virtual health clinic, and then offering them some of our ACN products. So making them aware of, through our partnership, we have, a very robust physician network on the North Shore, but there are products that if you choose to limit your physician network a little bit, you could save some premium dollars as opposed to going with the PPO plan. So we're also able to offer that through Ochsner.
Oh my goodness. So just the whole idea of corporate health solutions, I feel like next time we need a show just about corporate health solutions.
I would love to come back just for a show.
You have occupational health and you have workers' comp and you have general health services. You are there to talk to groups and talk about making healthy choices, but through the partnership too, you're talking about bringing healthcare into the workplace, and particularly using technology, digital and virtual options. The whole thing is just amazing. I'm so glad you came to talk to us today.
Thank you for having me.
You've been watching Healthy Living, and we've been talking today about community health resources. We learned about the initiative in Washington and St. Tammany parishes called Healthier North Shore. We learned about the mobile health unit called the Be Well Bus. And last, we learned about corporate health solutions from our guest, Erin. Thanks for joining us on Healthy Living. We'll see you next time.